Hello, I'm Marcel Neville. Time now for Sunday House Call.
And I'm Eric Shawn. Welcome as always. Joining us is Dr. Mark Siegel, professor of medicine at NYU's Langone Medical Center and author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hospital and chief of robotic surgery. Good to see you both,
Good
Doctor.
to see you.
Happy Valentine's Day to both of you.
Absolutely.
Very
Happy
good.
Valentine's Day. We got the red ties going on because that's a reminder about our heart health,
Yes.
protecting our heart, lessons for both men and women. Dr. Siegel, really important.
Go Red for Women Month. It's American Heart Month, but go red for women. And I want to talk about women because only about 50% of women realize that heart disease, Eric, is the #1 killer of women. People think it's breast cancer.
Yeah.
10 times more women die of heart disease. 10 times more women die of heart disease than breast cancer every year in this country. Women have different symptoms of heart disease than men do. They may not have the crushing chest pain and the shortness of breath. They may have tingling. They may have back pain. They may have neck pain. They may have throat
Tingling
pain.
where? Tingling where? I mean, in your
Well,
chest?
tingling traditionally in the left arm. That's where you generally see it. But you could see jaw tingling or jaw pain, back pain. Fatigue may be your only symptom, or nausea. If you're not feeling like yourself, especially postmenopausally, you have to get checked. After menopause, you have to get checked. Now,
What do you get? EKGs? What else do you do?
as an internist, I'm the front lines for this. Here's what I do. I check people with EKGs. I want to know your cholesterol. I want to know your sugar, that you don't have diabetes. I want to know if you smoke. I want you to know your blood pressure, by the way, not just me. You should know your blood pressure, your cholesterol. If you're smoking, you should stop smoking. You should lose weight. You should stop drinking alcohol as much as possible and not be sedentary.
I have a question quickly, if I may, to follow up with Dr. Siegel quickly, which is, you mentioned blood pressure. How often should you check your blood pressure? And what if you're not exactly in the suggested range? What is it now, 120/80? I don't know. What is it now?
Yeah, the last study, Marthel, this is a great question because the last study makes it look more like it's 120/80 or lower that we want, not 140 anymore. And the other thing I want to say, and this is my personal opinion, I'm not a big fan of the machines you use at home, the battery-operated ones. If you're using one of those, go to your doctor with it and correlate it with what he or she gets in the office. And then you could see if it's accurate or not.
Thank you. So, Dr. Samadi, let's talk about risk factors. Dr. Siegel mentioned some of them. And who's most at risk?
Well, women, we're talking about women because this month is all about go red and hence the tie. The reason why this is important is because women are always undertreated. This is very important. Underdiagnosed and undertreated. Because when we think about heart disease, we think of men. There's a stigma that it's a man disease. So when patients like women go to the emergency room or they go to the doctor, they're not thinking about like, hey, I should be ruling out heart attack in a 35-year-old, 40-year-old, 50-year-old woman. That's the big problem that we have. But the leading cause of death among women is still heart disease. More than breast cancer, lung cancer, and colon cancer combined. Every 82nd, a woman dies from this. And that's why this month is so important to go get screened. The other thing is that the symptoms, as Mark mentioned, are very vague. In men, we have that elephant sitting on our chest, severe chest pain radiating to the arm, and it's basically everyone knows about this. In women, you may have profuse sweating, nausea, back pain. You may have some arm pain. It's all vague. And
Why is there such a difference?
Well, the reason is because some of it could be anatomical, some of it could be hormonal changes, and we know that, for example, estrogen protects you while you're on it, and after menopause, your risk of heart disease may go up. But it's also important that young women are at risk. But going back to your risk factors, diabetes, high blood pressure. Why does high blood pressure and diabetes cause heart attack? The blood flow to the heart is something called coronary arteries. When there is a plaque there, the flow of blood is not going to get there. Therefore, the muscle in the heart becomes ischemic and can die, and that's a heart attack. So if you have high fatty food, plaque, high cholesterol, that's why it's good to check your lipid profile. That's why it's good to get your hemoglobin A1C, because that tells us whether you're diabetic or not. Blood pressure, if you have this plaque, can push it toward those blockage and cause this. Lose weight, stop smoking, stop drinking alcohol or moderation, and that's very important. And I think that the big thing is, if something is not right, call 911 and don't sit on it.
But Dr. Siegel, to that point, I did some work for Go Red for Women, the Harlem chapter, and many of the survivors there said they women didn't realize
That's right.
that they were having a heart attack.
You know, that's really, really important point you're making, because 2/3 of all women that die of heart disease did not have symptoms to begin with. But maybe they had some of the vague symptoms that David and I are talking about today and are calling it no symptoms. Maybe it just didn't feel well. And we always talk about time being brain with a stroke. Time is also heart. Let me explain what I mean by that. If we get you to the ER real quick, we now can get you up to the cardiac catheterization lab, open up that artery that's clogged, and stick a stent in. And if we do that in what's called acute coronary syndrome or a heart attack, if we get there fast enough, we can prevent damage to the heart entirely. So get in as fast as possible.
So, of course, it's Valentine's, so we want, you know, people online asked on Facebook, what should I give him or what kind of gift I should give her? I think what's important for her to pay attention that if your man is not functioning well, if he's not sexually active or is impotent at the age of 40 to 50, one of the early signs of heart disease in young men is impotence or sexual dysfunction. So make sure you don't ignore it. And getting a prescription for Viagra is not going to cut it. If he's a little older and has urinary stuff, make sure he goes to the doctor. And same thing for him, for her. Make sure, like, you know, cut down the stress, no more arguing. After the chocolate and strawberry and jewelry, make sure that she goes and gets checked with all the things we spoke about.
That is the best Valentine's gift I think anyone can.
The best.
And you know how to cut down on the argument, right? We're always
You
right.
say yes,
Women
right?
are always right.
That's right.
Okay.